Details of this vaccination drive. It's a mega drive set to begin tomorrow. So if you are more than 18 and if you've registered on the COVID portal, you are entitled to be vaccinated depending on when your number comes. Registration started on the 28th of April. There is a massive rush. As of now, what we are being told is that 27 lakh people are hitting the portal every second for registration. India has so far administered 15.05 crore jabs. 12.4 crore beneficiaries have got the first jab and 2.6 crore have even got the second jab as of now. The question remains, how ready is the government, whether at the center or the state, to administer these jabs? What we are also being told is that several private hospitals are also ready, as several states express their inability to initiate the universal vaccine drive. Some private hospitals including Fortis, Max and Apollo have announced that they will be ready to inoculate people above the age of 18. Hospitals are setting up special counters for those who've already registered at the COVID app and also have registered with respective hospitals for the jab. There are also special corporate vaccination drives that are being initiated. Do keep in mind that there is a separate price that you have to pay if you get a jab at a government hospital and a different price that you pay if you are at a private hospital. So as India gears up to inoculate 60 million adults in phase 3 of the vaccination drive, some states have said they are not ready. They say there are massive shortages. States claim they don't have enough jabs and that is why they'd rather wait, stock up and then start a couple of weeks later.
India's vaccine drive enters the critical phase on Saturday. All adults above 18 years will now be eligible for the jab against COVID-19. With over 2.5 crore people registering for this phase, in just 3 days, the new phase might not kick off immediately. Several state governments have now flagged the shortage of vaccines. Delhi Chief Minister Arvind Kejriwal has urged citizens not to queue up for COVID shots as the city has not received vaccine supplies yet.
हमें उम्मीद है कि कल या परसों तक वैक्सीन आ जाएगी, उन्होंने भरोसा दिलाया है। मेरी आप सब लोगों से निवेदन है कि अभी कल आप सेंटरों पे लाइन में मत लगिएगा, कभी उसकी वजह से कानून व्यवस्था ना गड़बड़ा जाए, कहीं ऐसा ना हो कि सोशल डिस्टेंसिंग खराब हो जाए, भीड़ लग जाए, अभी वो सब मत करिएगा।
Other states have echoed the concern.
अभी हमारे पास कोई इस तरह का स्टॉक नहीं है। अभी केंद्रीय स्वास्थ्य मंत्री को भी लिखा है कि हमको वैक्सीन उपलब्ध कराए। भारत सरकार को इस आशय के साथ लिखा है कि या तो वो हमको डोज दिलवा दे या कहीं से भी दिलवा दे, क्योंकि 1 तारीख प्रधानमंत्री जी ने इसका ऐलान किया है, तो इसलिए इसको हम लोग चाहते हैं कि इसको 1 तारीख को प्रारंभ करें।
मुझे लगता है कि भी शायद वो हम उस टाइम पे स्टार्ट ना कर पाए, जिगर आज तक अभी तक कल हमारे पास 2 लाख आई थी, उससे पहले 1.5 लाख आई थी, लेकिन अभी तक हमारे पास कोई इंटीमेशन नहीं है कि आज हमको कितनी मिले, कल कितनी मिल गई है।
तो जब 50 लाख की डिमांड है, उसकी पूर्ति नहीं हो पा रही है, तो फिर ये 1 तारीख को कैसे शुरू होगा? और जब प्रधानमंत्री के द्वारा जब घोषणा कराया गया, प्रधानमंत्री जो घोषणा की, तो भारत सरकार के बैठे हुए अधिकारियों की इसकी तैयारी कर लेनी थी।
Vaccine shortage is affecting the existing phases of the drive as well. Whether it's Punjab or Tamil Nadu, UPA ruled or NDA ruled, the crisis is everywhere. In Odisha, 12 districts have stopped the vaccination drive after their doses dried up.
Till yesterday, the vaccination program was going on. By now, we have already vaccinated more than 57 lakhs of doses we have given. 12 districts, there is no much stock to conduct the session. So, in 12 districts, the vaccination has been withheld for today.
Vaccine maker Serum Institute of India, which provides the bulk of vaccines, is likely to get orders for 34 crore doses from states. Vaccine makers have made it clear they will fulfill orders of the central government first. This could mean a longer wait for states and those eligible in the 18 to 45 category. Bureau Report, India Today.
And joining me now on India First is T.S. Singh Deo, the Health Minister of Chhattisgarh. Minister, welcome on India First. How do you see the vaccination for all drive rollout starting the 1st of May? And when is Chhattisgarh likely to begin the drive?
We are starting tomorrow, Gaurav, and it's an uphill task. Uphill in the sense that we have limited vaccines in the country, but whatever vaccines would be available, even in this lockdown, we'll try and see that as many people as vaccines are available get covered and vaccinated.
Excellent. Sir, there was an apprehension that there could be a lot of crowding, and Delhi Chief Minister Arvind Kejriwal has asked people between the age group of 18 and 45 not to queue up at vaccination centers till the time things are better. Sir, you've placed an order for about 25 lakh vaccines with the Serum Institute and another 25 lakh with Bharat Biotech. How soon are they likely to arrive, and what is your total requirement?
We will be placing another 25 lakh vaccine order with Serum Institute. Bharat Biotech has been more forthcoming, and they are making 1,50,000 vaccines available tomorrow morning. So those are the vaccines with which we are going to start. We will be rolling them out tomorrow. Those places where logistically the vaccines will not reach tomorrow, they will be covered started from day after.
And no issues with Bharat Biotech's vaccine, Covaxin anymore, because the centre, as recently as a couple of weeks ago, had accused Chhattisgarh of fueling vaccine hesitancy. Has there been a change of heart when it comes to Covaxin?
The issue was not about Covaxin, but the methodology that was adopted, and I am still on the same platform, that we must follow internationally accepted protocols even under emergency use authorization. So when Covaxin was rolled out, it was under emergency use authorization, but under clinical trial mode. So you were having to sign forms, etc., and then take the vaccine. After the government of India removed that provision for clinical trial mode, you no longer need to sign a form when you're taking the Covaxin injection. So that is when we also started using Covaxin.
The opposition, sir, has accused the Chhattisgarh government, in their words, of being lethargic and leaving the heavy lifting to the centre. Is there merit in the allegation that governments, the state governments, should have reached out to manufacturers earlier instead of letting centre or waiting for centre to do all the work?
We were not waiting for the centre after the announcement. In fact, Chhattisgarh was one of those states who reached out, placed orders, and has been able to secure, no matter how small a quantity, we have been able to secure the vaccine. And you had also mentioned vaccine hesitation. Had any step taken by us, whether regarding Covaxin or any other, had it engendered vaccine hesitation, Chhattisgarh would not have been among the leading vaccinating states of the country. We have reached about 16.5 to 17% coverage, whereas the national average would be 8.5, maybe reaching 9, 8.5, 9. So vaccine hesitancy is another bogey which unfortunately our friends from the opposition are raising in Chhattisgarh.
Okay. Pricing remains an issue even now, Mr. Deo. Our states and the centre, why are they not coordinating on this drive, or are they coordinating on this vaccination drive between 18 and 45? And as the Health Minister of Chhattisgarh, what are your expectations of the centre from this point on?
A national program, a national vaccination program. This is the first I'm hearing in the history of the country since independence that a national program has been split into Government of India partaking some responsibility and the state's government being asked to take the other. In fact, it is 1:2. If 1 crore people are being vaccinated by the Government of India, 2 crore have been left to be vaccinated by the states. So this is most unfortunate as far as that policy decision goes. I still feel the Government of India, though I doubt very much it will reconsider, it must reconsider and go back to the common platform of the Government of India purchasing the vaccines and supplying them equitably to all the states.
Will Chhattisgarh also be looking at foreign vaccines in times to come, or would your entire requirement be met either by Serum or Bharat Biotech? You know, Sputnik comes in, others likely to come in?
The issue is the approval of any vaccine made abroad by the Government of India agencies. So once the Controller General approves any vaccine which has been produced internationally, we would be happy to reach out to those companies and purchase them if they are cost effective and use them in the state. Also, if local manufacturing is not ramped up enough and the vaccination program is getting delayed beyond acceptable timeframes, then we'll certainly reach out to foreign manufacturers or vaccines available in other countries, subject to the Government of India permitting us to do so.
Mr. Deo, for the moment, many thanks for joining me here on India First.
Thank you so much, Gaurav.
So there are problems. What's the road ahead and how bumpy or smooth is it likely to be? Joining me on the rollout of the vaccination drive on India First is Professor N.N. Mathur. Dr. Mathur is Director of the Lady Hardinge Medical College, and Professor S.K. Sarin. Dr. Sarin is the Director of Liver and Biliary Sciences Institute. Dr. Mathur, at the Lady Hardinge Medical College, are you vaccinating people? Is that vaccination drive likely to start? You know, will there be ultimately, when it starts in Delhi for 18 to 44, will there be separate counters or separate queues for 18 to 44 and 44 for 45 and above, sir? Or is there an apprehension there could be a lot of chaos and a lot of people assembling there and could well be a COVID hotspot?
See, as far as the Lady Hardinge Medical College is concerned, tomorrow probably we are still awaiting the directions. Tomorrow we'll be probably continuing with our going on vaccination program, which is 45 and above, and healthcare workers who are a little bit left. And tomorrow we probably in the private sector, maybe it will be starting. We are not, we are awaiting the orders.
Okay. Dr. Sarin, for a nation that's battling the pandemic and the manner in which we are battling, does this not appear to be rather poorly planned, and there appears to be so much confusion about the execution of this initiative?
Well, first of all, it's a huge initiative. Let me put it, the developed country like the US, they have started only on April 19th, just about 10 days ago, the vaccine for 16 and above. And US has almost 5 doses per person. India had almost 0.15 dose per person in the beginning, and now maybe a little more. So as a country as large as India, you can imagine that how many billions of dosages we require, and we need much more pumping. So to say that we have probably not prepared is another way, but we can also say that we have started maybe 18 to 45 a little early. We should have done more planning for 18 to 45, but as of now, I think even, let us understand, even if you give to the available dosages, and hopefully Sputnik will come very soon, even if you have given first dose, you will be able to mitigate to some extent the severity, the likely deaths due to this. And I think that it's a huge initiative. People do not appreciate what India has done. Even today, let's take of Russia. Russia, as of April, they were the first to get the Sputnik vaccine, Sputnik 5. They have only done 9 million. In Russia, the vaccine is available on the street in the public, but they are not taking it. In India, you can see, you yourself has said about 2.4 crores have registered. So we have enthusiasm. Indians as a country, as citizens, they have an excitement, they have a commitment to get the vaccine, which is a very important part. The hesitancy is gone.
Yes.
Now it's only a time that we ramp up, whether we open up to the foreign vaccine, let's say we get the Pfizer, Moderna, or we get J&J, which is a single shot. We should have enough of them by the end of maybe this month. I feel that people should not pressurize, should not make it a point. Tomorrow is the first day.
Yes.
I must see first show, first day of a movie. It's not like that. You plan it. Those who are not going out every day for earnings or for other things may kindly wait for some time.
Okay.
Let those even in 18 to 45 realize that this is the time that you can give priority to those who actually have to do their earning of the bread and they go out.
That's a very
So I think
important
in a
point that
month's
you
time,
make, Dr. Sarin.
very-
But Dr. Mathur, prioritizing who should go first, who should go where and when. Should all of this not have been done either by the center, or if center has delegated this responsibility to the state, by the state government, instead of this kiosk with 2.45 crore having registered and not knowing what to do next, sir?
No, I think there had been quite a lot of coordination between center and state, and a lot of meetings have taken place, and all these plans have been very thought out. There could be some issues here and there. This is a massive vaccination program, and so it is not all that simple or easily doable. And I think all these issues will be sorted out.
Okay, that's heartening to hear, sir. Dr. Sarin, the Chhattisgarh Health Minister, and you just heard him, he said even with limited numbers, they will start, they will roll out tomorrow. Delhi, of course, Arvind Kejriwal, the Chief Minister, says they will wait till they have built up certain stocks, and then in the next 3 months, they will go ahead and vaccinate everyone. Which, according to you, is a better approach to take, Dr. Sarin?
I think both are taking the same approach. I think Delhi is waiting maybe for a day, as far as I have learned. Maybe by Sunday or Monday, if the vaccine comes, they have ordered for 1.34 crore dosages, which is a substantial number. So I think as and when the supplies start coming, Delhi will also pick up very fast. And as a policy, we should have, you asked this question earlier, as a policy, we should have those who are 45 and above are coming for their first or a second dose in the morning shift or a separate shift. Those who are coming, I recommend and I request, coming between 18 and 44 should maybe come in the daytime or maybe later in the day, so that they can really have to stay for a shorter period of time. They can have their bread and in the morning. So we must segregate the groups, those elderly or above in the morning and those coming for second dose in the morning. And for that, vaccine is already being provided by the center. That's a separate thing. It is for 18 to 44 that the states have to provide for, and therefore we should have a separate section, counters, and maybe support for them. Now, strategy wise, I think the faster you move, the better you are. If you have vaccine, nobody will say that don't vaccinate everybody.
Yes.
But let's say we will get the vaccine within few weeks and we will vaccinate everybody. But first shot, everybody should take. Otherwise, we may have more severe infections.
God
This
forbid,
virus
because
is
the situation
deadly.
is scary.
This virus
Yes.
is more severe.
This indeed is. It indeed is. Dr. Mathur, Dr. Sarin was just talking about segregation, and that was the question I was coming to you. Do you foresee a requirement to set up special camps, perhaps in open grounds and parks and community centers, to vaccinate people in larger numbers to avoid queues in Delhi? I mean, again, that's a point that Delhi Chief Minister Arvind Kejriwal was raising. Don't just rush to a vaccination center. Don't let that become a COVID hotspot. So should it be more spread out now that you're looking at larger numbers?
Yes, it could be the possibility, but this is for the administration to decide. In some of the countries, you have the drive-in facility that you can go and just drive in, and in the car only the vaccination is given and you drive out. So all these things can be looked up by the administration. I will not be the right person to comment about it.
Indeed. Dr. Sarin, several private hospitals say that they are good to go. Some others are saying they will not be able to vaccinate people since they don't have stocks just as yet. And the central government, according to these hospitals, have said return the existing stocks, people that you haven't been able to vaccinate so far. Is that counterproductive? Is this not a situation where you need all hands on the deck to vaccinate as many people as possible?
Well, I do agree we should do that, but there is something like, a little more transparency. If the private hospitals are providing, then somebody is being deprived. And that is because you can pay, you go there. I think if you had to apply a policy like this, maybe all EWS and others, maybe government supplies, but everyone else should pay for it. If everyone pays, it's okay. But not that somebody who can pay and goes to a hospital and he gets a shot. In fact, the virus spreads faster in people who are in close contact, and who are in close contact, poor people. They are unable to have that space in their house. They are crammed up, 6-8 people in one small room. So I think the bottom-up approach where we can help people who are not so privileged, vaccine should be made available to them first. I'm not saying don't go and get vaccinated in another hospital, but I think the availability of vaccine should be based on equity and should be based on the need of the people, elderly and those who cannot afford otherwise must have also an equal right to the vaccine.
Because what is heartening, Dr. Mathur, is a point that Dr. Sarin was also making, with 2.45 crore people having registered. One is very clear, that vaccine hesitancy, if at all, is really on the decline. So how can this process be scaled up to vaccinate as many people, at least with the first dose? Should that be a mitigating factor?
Yes, it's very unfortunate that this has happened this way, but it has happened for that way. It has happened for the good, that the hesitancy has turned, vaccine hesitancy has turned into vaccine urgency now. And but the hesitancy is no more there. It's not an issue at all now. And but we didn't want it to happen with this method, but it has happened.
Oh, absolutely. I sincerely hope that people register and get themselves vaccinated as quickly as possible. Dr. Sarin and Dr. Mathur, many thanks for joining me here on India First. A quick break at this stage. On the other side, Delhi Police Commissioner Sachidanand Srivastav joins me on raids that are being conducted